I'm Dan Erkes. I'm a senior editor for the Lancet. It's the 200th year anniversary of the Lancet, and as part of that, we're shining a spotlight on multiple areas of health. This podcast is focused on researcher health, specifically the relationship between a young and more established researcher. Today, our two guests have a unique mentor-mentee relationship that we will explore further. Our first guest is Laura Marcela Aguirre-Martínez. Laura Marcela is a 25-year-old Afro-Colombian physician and a member of the Youth Advisory Panel of the Lancet Child and Adolescent Health. My second guest is Lyda Osorio. Lyda is based in Cali, Colombia, where she teaches epidemiology and clinical research skills to under and postgraduate students at the Faculty of Health of Universidad del Valle. So I wanted to welcome you both to the podcast, and I guess we'll just jump right in. So the first question will be for Laura Marcela. I was just wondering, what is your current role, even though I said it in the introduction? What is your current role and how did you arrive at this point?
Okay, hello, Dan. Thank you very much for the invitation. Hello, Dr. Lyda. I currently work as a physician in the clinical unit of CDA Corporation in Cali, as you said before. And my main focus is the clinical evaluation and follow-up of patients with leishmaniasis and neglected skin infectious disease. And further, I support the attention of patients with sexual transmitted infections and research projects in both areas, as well as a project in malaria. I participate in academic activities, in courses, in the writing of manuscripts, and administrative tasks as well, and others. So it's like an integral job and a great formation program. And about the second point, about how I arrived to this at this point. Okay, so I think I got this far thanks to God, to my family, wonderful and inspiring people like Dr. Lyda and Dr. Yoni Garcia too, who always believe in me and encourage me to pursue this path, So also thanks to various national and international experiences that made me expand my view of the world and considering research as a path.
To Lyda, what is your current role and how did you arrive at this point in your career? But also, how has your career changed compared to how you initially envisioned it or where you initially started?
First, thank you again for the invitation, and it's an honor to be here in this podcast and sharing with Laura. It's like a dream come true. Like we can share what this relationship in terms of mentoring and next generation scientists has been, and I hope it's inspiring for the generation of researchers. That I am in a very privileged position because I am I'm employed in a public funded university in Colombia, which is something that very little people have the opportunity to have, and it gives economical stability. I have also the privilege to meet new generations of students of medicine and other areas of health, and also meet people like Laura, who is very passionate, excited, had many ideas. It moves me in my own interest and try to encourage them and give them some advice. I think it's an honor to do that. I can pursue my own research interests in a very open and academic environment. I'm multidisciplinary, so I can approach many different areas of research within my university and also internationally. So I'm very pleased with my current position. I didn't envision this initially because I thought that teaching was taking time from my research and I didn't know how to teach anyway. So I envisioned my stay like a full-time researcher in Colombia, always in Colombia, because I wanted to share what I've learned here with and produce knowledge that will improve our quality of life here in Colombia. But I had the opportunity to apply for this job at the university, and I saw it as a way to have economical stability. So for researchers, it's very difficult around the world to have this economical stability, and this position gave me that. And then I fall in love with teaching, and I love that to do now too, and be able to have both research and teaching.
That's great. It's funny because I feel like I'm similar, where I'm a scientific editor for the Lancet, which is one of the leading medical journals in the world. But my background is I am an immunology basic researcher. That's what I did my PhD in. So I never really thought I would be an editor, but it's always funny how career paths kind of end up maybe in places you weren't expecting for whatever reason. So I guess back to Laura Marcela, given where you are now, where do you see your career and your research going, and how do you want to build it to kind of get to that point that you're hoping for?
To be honest, if the paths are changing continuously for you, for Dr. Lyda, you can imagine how is it for me. It's like every day I'm asking me the same things that you just asked. It's like I certainly have a position in this moment. I have like an answer now, but easier if we talk again in 2 months or I don't know, 6 months or a year. Maybe my decisions were different. I don't know. So for now, I would like to do a master in public health. I would like to do that or in global health starting next year when my fellow is done. It's already done here. And hopefully a clinical specialization after that. So I see myself continuing my learning and working in infectious disease, specifically in neglected tropical diseases and STIs, but with a special focus in the impact of these conditions in mental health, as well as in social health. So I think stigma and discrimination can affect significantly the quality of life of the patients. Yes, so I also have this interest in social determinants of health and like new ways to address them. So I would like to learn more about qualitative methods, about mixed methods. Currently, I'm doing that. And well, however, as you say in the beginning, I'm passionate about a lot of things, as Dr. Lyda said before too. For example, about writing. So I see an alternative and valuable way to build novel interventions in public health using tools like narrative medicine and medical humanities. So I'm convinced that I will find the way, like to meet my different interests and passions in the future. Well, like in order to develop interesting and diverse research and public health projects.
That sounds great. And I think you have a good attitude towards it where you have ideas in mind and you're pursuing them, but they're also allowing you to potentially branch off more in the future. So you're not necessarily pushing yourself further into one area. You're continuing to broaden, which gives you, I think, a lot of possibilities. So I guess kind of going off of what you said and going back to Lyda, what would be some of your suggestions to kind of help guide Laura Marcela kind of on this journey? So you could answer specifically or more broadly, like how do you build on a career, on a research project, on a teaching career or something like that?
No, I think what Laura, the way that she has expressed herself, I think that's the most important. It's not the content, but the passion that she puts in her words. I think that's very key to build up your career in any area. So is that keep that passion. Don't let it diminish. Keep finding that passion in what you do, and you will do it. There are things that everyone needs, like guidance, studying, pursuing in spite of the obstacles, being prepared for the opportunities. But I think the most important that is that you remain open, because there are so many opportunities there. You don't have to have that fix or even let some opportunities escape because you are fixing something, or you remain open. Also in the ideas of research as well. It's not only your career, but what areas of research and how you can combine different ideas, etc. So it's very important that the feeling that you have about what you want to do in the future. Something that I want to share is that it was very important for me, like in my mid-career, was I learned something about a cycle that I thought it was very powerful. A life cycle, I like biological pathways. So finding something that I can apply for research skills, it was very useful. So this cycle is learn, share, and learn. So I love that, and I would like to pass on like my inheritance slogan, something like that. as a researcher. It's like, keep learning everything that you can. Well, it doesn't have to be a single topic, like you just said, Laura. You have many interests. You just learn whatever you want to. You remain curious and learn about it. But it's also important to share that knowledge. It doesn't have to be formal teaching, but that you share. You are very generous to others with what you have. And also in that process, receive that feedback, and then you learn from that process too. And then keep sharing that new knowledge. I love that, and that has been very powerful for me.
Thanks so much. I don't know, it's really cool to be on this end and seeing you two have this conversation, because everything you're saying, Lyda, is kind of coming from this mentor relationship. So as Laura Marcela progresses through her career, she can always come back to you for these types of advice, and it's really great. It's kind of rare that you have that, and it's so important for developing and moving in a direction you want to move in. So I think we're gonna shift just a tiny bit, same area, just shift a bit. And I think we're gonna talk more about generational differences that we experience, because we're all in different generations, right? So I guess to Laura Marcela, how do you think the landscape of research or medicine differs for your generation of younger scientists and clinicians compared to previous generations?
Okay, then so yes, I have I have certain thoughts about it, of course, but I want to start having a voice in research or in academia or in this type of spaces. Like this podcast is a great way to start answering this question. For me, for example, being in the advisory panel of the Lancet, having a voice, having a proper way to express my thoughts and my ideas and my opinions about the editorial agenda, for example, that is valuable. And I think that is new. That is like a novel approach, to the new generations, to my generation. It's not like the common way to do the things in academia. Like it's a new way. So I think the voice is something different for our generation. So this is like the first point I have. And well, I have a few ones more. Like, sincerely, I think that as young people in academia and research in clinical settings, we have strong challenge happening every day. Like technology. Technology is advancing very fast. With that, also the gap between the low middle income countries and the ones with higher incomes. Yes, like in terms of education and financial terms and scientific development, like this gap is increasing. That is truth for me. So education is a human right, but in Colombia, as well as in most of the countries, millions of children and adolescents cannot even read. I mean, it's nice to talk about research and academia, but we are just like a few of us lucky people who make it to the university life, like to the professional career. So we, the few ones who are being motivated in pursuing academic and clinical careers in medicine. But the truth is, we have to deal with a lot of problems, like in the context and in this path, like lack of financial support, like racism, like social inequities, like violence in the streets, and even inside the universities, inside the hospitals, like long working days, etc. So I think for this generation, those challenges are big, and those challenges make even harder to achieve the goals. So I think there are few differences, of course, but I just want to say that like every day in the world, it's more technological ways to perform procedures and to access to the information. This is easier like every day than a few decades ago, if we compare. But the basic needs are still unsatisfied in millions of people, and the human rights violations are happening around the world. So it is hard to follow the academic path, particularly when you come from a vulnerable population. So yes, that is what I think about it.
Thanks. I feel like I have so much to say to respond, but no, you're right in so many ways. There's a stat I saw. So I live in Philadelphia, in the United States, and there's a stat I saw that something like 25% of all Philadelphians are illiterate, which was kind of shocking to me. And it kind of goes to this idea that we are in a privileged position, and, it's not necessarily easy to get there. And there's all these things we have to overcome. But another thing that you said that really stuck out to me was your voice. And I just want to acknowledge the youth advisory panel, because I'm still, for the Lancet Child and Adolescent Health, I'm still kind of amazed. I think it's great that there's a platform for you to say what you want and help shape research moving forward. And it's really great that this youth advisory panel is there to help you do that. So with that, I just wanted to turn to you, Lyda. You can respond to what Laura Marcela said, but also kind of in that, and you've kind of said this before, so what in your career has shaped you, and kind of what advice would you give to Laura Marcela to kind of, to this next generation that she's in, and kind of some of the problems that she is facing and what she has to overcome?
They say that predicting the future is easy, usually when the future is happened already, but it's difficult when it is when you haven't lived there yet. So it's these exercises, I think, are very cool, but I don't use that too much in how things are going to be in the future. It's interesting as a good exercise, but I need beer for that, or a coffee, a good coffee for the discussion. I think in terms of building a career in the current context is very changing, very changing. For myself, for example, having a scholarship and being able to do my PhD abroad was key, was very important. But for example, currently you have online courses. You can do your PhD online or whatever training. So doesn't necessarily have this issue that I had at my time, that was 7 decades, to do that. They have the access to good universities, good training online. But for me, that was very important. And now I think for people, it's going to be more important to actually interact with other researchers around the world. People like Laura are more confident about themselves. She said, I got a voice. I can talk to the Lancet people. So for that, my generation, I needed to demystify Europe or US, or researchers or editors, because we have this cult, like these very smart people doing very smart things, and they are, but it doesn't mean that we cannot do it or we cannot talk to them directly. So, but the generation of Laura doesn't need that. They talk openly and they're very confident, most of them. So I think it's very difficult to envision how that career is going to be in the future. But I think the basics of what a researcher is, keeping that curiosity, having certain skills that is going to help to do the things more quickly. Yeah, skills that you need for your research, networking, talking to different people, being able to negotiate, the leadership that we have, and also that sensitivity to being a citizen of the world. That Laura was saying, talking about human rights, talking about vulnerability, social determinants of health, to be able to have that complexity of the world in your mind, but at the same time, focusing in something that you can contribute to, doing high quality research. But don't lose that big picture. And that sensitivity, that humanity as a researcher is very important.
Yeah, I don't know if I'm in the generation that had that same voice, but it is always nice that younger people feel good speaking up, because I didn't always feel that way, and I think it's really great. And again, the youth advisory panel, the fact that you're even on it is extremely impressive. So you should feel really proud about that, Laura Marcela. All right, so shifting gears a little bit more, the last 2 questions are going to be geared towards both of you. So we can keep it in the same format if you want, or you can kind of free-for-all answer, whatever you prefer. So I think a really important part of this talk, or this conversation, is a work-life balance. And I know for me, that was key in shaping my career, and why I ended up being an editor, because I was much better able to have a work-life balance. where when I was in research, I was very bad at keeping that barrier, and it kind of just, the work became my life. So I guess, how do both of you handle work-life balance, being that you're at much different stages in your career?
Well, for me, this is a hard question. I actually think that school implies sacrifice. Like, I sacrifice a lot, but still I used to do a lot of things. But now that I'm working in research and in this clinical side too, I'm trying like to put the things in order, maybe. So I don't know. I think for Dr. Leah, it's easier to answer it since I know her and I know she's a disciplined woman. But until now, I'm learning how to achieve this balance, you know? So for me, it is always necessary to make time in my agenda for diverse activities like that make me feel alive, inspired, happy. So, for example, every day I spend time learning German from a few minutes to a few hours. I exercise several times a week. I try to be strong in general. I try to disconnect myself, like work in the weekends when it's possible, to share time with my family, with friends. And also, especially in this moment, I'm taking serious my career as a writer. So I am working at nights and weekends in my first book of short stories, and that implies a lot of reading and more writing, but like in literature, you know, like it's totally different from academic writing. So that's a little bit hard, but I'm pretty happy about that, about this path too. So yes, but finally, I think I should improve my time management. Like, this is like a current challenge, and especially my sleeping hours that are still just a few. So yeah, that's it for me.
I think it's interesting you then being the only man in this conversation, saying that you find it hard. Yeah, because then when we have these cultural roles, like you are the provider, you're expected to be like working all day or something like that. And then for women, culturally, we still have that burden of care, being the perfect housewife, being perfect and daughter, mother, etc. So it's very interesting that you said for me it was hard as well, because I think that's not the case in many parts of the world. And then this imbalance it's actually harder for women because of this cultural context that we have. And actually for me, I didn't feel that there was a problem quotes, because it was a nice problem to have until I was a mother. And I think it's has to do with prioritizing to be able to reach that balance. Laura, 10 activities, she's very busy. Like many young people, they want to do many things. They want to tear the energy, and they have to because they have a lot of energy. And also they had so much knowledge. They know how they have to exercise, to eat well, to sleep, to study, build their careers, and pursue their interests. So they are very busy, I think more than I was in my generation. But at the same time, I think it's prioritizing. So when my son was born, my priorities changed. It wasn't my research career anymore, the first priority that has been almost my entire professional life, and even as a student. But now my son came first, and actually my family. And that, I think it was a conflict, because I thought that I wasn't doing any good to both of them. I wasn't being the best researcher I could be. I couldn't be the best mother and wife that I could be, because I wanted to do both. And that takes time. And it's something that you reflect, and then you understand what your priorities, how you feel better. And until you find that balance. And I think that's finding that balance is a matter of making yourself more comfortable in the environments that you enjoy. I don't think some people choose one of them as their decision is perfect for them because that works for them. Some of us choose to have both, and then it impacts both. I have to be honest, impact both, because the productivity decreases. That's not necessarily because of my fault, but the context how much protection we have as women in science to have a context that favor that we keep our productivity, keep the standards that we want to achieve, or to build a career the way that we want it, when we actually have a lot of care to do and other activities as well, other duties in our personal lives. But I think that's very important, just to observe yourself in how do you feel better and prioritize, because sometimes you cannot do all. That's the truth.
Thanks so much for that. And no, it's good. It's good to call me out too, because I'm definitely in a privileged position where I was able to actually make that choice of having more of a work-life balance. And like you said, I have a 2-year-old and I'm still struggling to figure it out. It's really hard to figure out, when to work, when to be a parent. Will I ever have time to have a hobby again, type of thing. It's difficult.
Then have you found that working from home, is it helping, or actually preventing you from finding a better work-life balance? Because now we can work a lot from home, and I see you're at your home. So how that's working for you?
It's helped in that I get to see my daughter a lot because she's home most of the time. So, I take a 15-minute break and play with my daughter. But at the same time, she will eventually go to school. Maybe working from home won't be the most ideal thing in the world, but that's versus something for me to figure out a couple of years down the line. But so far, it's been pretty good. And we do have a North American editorial team, so I do occasionally go to New York to see them and have meetings with them. And the hope is that I'll go to London at some point. But yeah, you're right. I am mostly at home at the moment.
Yeah, I think that flexibility in your employers and policies are very important for that work balance. And I would say the flexibility with yourself, be flexible with yourself as well to find it. Yeah, that's great.
And again, I feel like we've already answered this, but we'll just more explicitly ask. So, and this is again to both of you. So what is the role of an established scientist? So what is the role that Lyda, say, has in the next generation of scientists? And from the conversation we've had, it's clear that mentorship is key. But I guess I'm wondering from both of you what your thoughts are on this.
I will start saying, I think that established scientists should be an integral company in the scientific training of young people interested in research. But one thing is established scientists, right? And the other thing is mentors, like this great figure of mentor plus other responsibilities, I think, or other features. So it seems to me like this is essential to have mentors who inspire you by example and help you to structure your thoughts and ideas. So I think it is easy to get lost along the way. And yeah, despite your motivation and despite your hope, it's easy to be insecure about knowing how to start a path or how to start a new project or how to continue. So, but I just want to improvise here a little bit, and I want to tell you a short story from Dr. Lyda and me. And I don't know, I'm not sure that she has an idea of how much that meant to me in that moment. But I just want to share this. Dr. Lyda, a few years ago, went to the library, to the public library, when I had a presentation in poetry. I participated in a poetry fest, went to the library to see my presentation. I was super surprised, of course, and that is so special for me. And I think that it's a great idea and a great I don't know how to say, a representation of what a mentor should be. It's like she knows me and she knows that literature and poetry for me are super important, and she went to that space to see my presentation with 2 poems or something like that. So I think that that's a privilege, and I think that the mentor or the person are being your company, your inspiration, should know not just about your academic goals, but who you are, who you really are. in the middle of your heart, what you wish, what you want to do. Every single young researcher or young student should have a mentor in this position of like being interested in knowing who you are and who you want to be, even when you are just like discovering. So yes, I believe that established scientists and mentors should be aware of the current context, the full context of the students and their challenge, as well as like the importance of the mental health and the physical health of the young researchers, no matter what. Even the deadline, when the deadlines arrives, or even when the things are difficult, like prioritizing the human being in their students and in their mentee.
Thanks. That was a really great story. It's kind of just like how far showing up can go to show that you care and that you're involved in someone's life. It's really important. So sorry, I didn't mean to interrupt. Lyda, what are your thoughts here?
No, I was very privileged, honored that she invited me. And I love it. That was a great experience that we have. And but anyway, I will say that as established scientist, as you call it, and I think it's meant an older person with for more years in the area. It's I've been very moved by the importance of diversity in science, being inclusive, and I have been more aware of the barriers that science have to many people. Let's call minorities or something like that, but I don't know the exact word that will work better, but people that have felt that they cannot pursue a career in science. Initially, it happened to me because of the background of my family, that it wasn't, and they were thinking that economically I could contribute more to my family as a clinician, but less as a researcher. But they never made me feel that way. They were always very supportive and do what you want to. Be happy in what you want to do with your life. And that was key. So the mentoring of your family, as Laura said at the beginning, is key. But not many people have that, unfortunately, in our society. So we have to be, as established scientists, being more proactive in how we modify those environments to make them more welcoming to people that may feel that they don't know have a career in science for whatever reason, economically, or like Laura was saying, aggressive in terms of microaggressions due to race or religion or gender or whatever. Even for women. Remember that what I said about having children? So women that want to have children, they said, no, I don't want a science career because then I won't be as productive as I could be, or I won't be as a good mother as I want to be, or a housewife or whatever. So we have to develop and institutionalize programs that make that science environment in pursuing a career in science more welcoming for people. Mentor is part of it, but also it has to be flexible policies, as we were saying before, at institutions. Also, we have to make differences in terms of how we fund research that will support funding that kind of research, and other strategies that we need to develop to be able, just talking about how to be more diverse and inclusive, and also in activities like you said, like the panel at the Lancet, to be more inclusive as well, give voice to different people and different strategies to do that. Science is for all. We need more people to have diverse perspectives in science to improve it, because it's so complex. We need diverse perspectives as well, and people that bring new ideas as well and challenge the old ideas and perspectives. And for that, I think we need to support more those environments that will be more inclusive.
Great. Thank you. That was a perfect answer. Yeah. So, I mean, I guess at this point, I've asked all the questions that I have. Is there anything that either of you want to ask each other? If not, that's also fine.
No, just give back our contacts and people that want to share ideas with us. If something that we have said have resonate with them, we'd like to hear it. It's this learn, share, learn cycle. And this is a great opportunity to learn from other people, their points of view and their reaction to what we said. I am interested. So thank you, Dan. And Laura, it has been an honor to have this time with you.
Thanks so much for joining us for this episode of the Lancet Voice. This podcast will be marking the Lancet's 200th anniversary throughout 2023 by focusing on the spotlights with lots of different guest hosts from across the Lancet Group. Remember to subscribe if you haven't already, and we'll see you back here soon. Thanks so much for listening.